Good afternoon, everyone, and thank you for allowing us to participate with the Prince William Chamber Transitions Aging Gracefully Virtual Expo. I am Dr. Arkina Daly, physical therapist for Centera Northern Virginia Medical Center, and I currently practice at the Century Therapy Clinic. At our clinic, we treat pain that's located in your neck, back, arms, legs, and even pre- and post-surgical conditions. I am currently the team coordinator for our chiropractic, physical therapy, and pediatric speech therapy clinic. I have practiced physical therapy for 19 years. However, I do my very best to still listen to each client and assess each and every one on an individual basis. So the theme is aging gracefully. Therefore, I'll be talking about those aging joints that you may have in your shoulder, hips, and knees. However, they can also occur in our feet and ankle. Let's talk about the shoulder joint. Shoulder osteoarthritis results from wear and tear of your shoulder joints. The joint is made up of a shoulder socket where the arm bone connects. Smooth cartilage covers the surfaces of the bones in your shoulder to allow smooth and pain-free arm movements. If the cartilage is injured or worn away by overuse, arthritis may occur. With this condition, you may feel pain when the bones rub against each other, while you're reaching overhead, lifting your arms to clean, or with even driving your car with a raised arm. A prior injury to your shoulder can contribute to shoulder osteoarthritis as well. If you are older than 60 years old, you may be at greater risk for osteoarthritis. Shoulder osteoarthritis may cause aching, pain, stiffness. Using the shoulder often worsens the pain. Therapy can help teach you to manage the pain of the shoulder. Your therapist can also help you move safely and perform exercises for shoulder strength and to improve motion. Hip osteoarthritis is often described as wear and tear of the hip joint. The hip is a ball and socket joint with the ball-shaped top of the thigh bone fitting into the cup of the pelvis. The surfaces in the joints also have cartilage and acts as a cushion with each step to protect the bones when you put your full weight on the hip for walking, standing, or going up and down stairs. In osteoarthritis of the hip, the cushion is worn away and the bones may rub on each other as well, causing pain in the joint with motion. As the condition worsens with time or one waits too long to have the hip checked out, bone growths called spurs can form. This can create even sharper pinching-like pain. This wear and tear often worsens with aging or caused by a prior injury to the hip, perhaps from a fall. Being overweight or having a family history of arthritis can increase your risk of developing this condition as well. So osteoarthritis of the knee is a common cause for pain as well, and knee pain is definitely more common than the other two. Your knee is formed from the thigh bone, the shin bone, and the kneecap. The surfaces where the leg bones meet are covered with a smooth, shock-absorbing tissue called cartilage. This cartilage helps the joints to glide smoothly during movements, and this cartilage can wear away from overuse and from a sudden injury. The same reason for the shoulder and hip can cause pain, stiffness, and swelling. However, having diabetes or other types of arthritis can increase your risk of having these conditions as well. So what are some common symptoms of OA that you may experience? Stiffness are common symptoms of joint osteoarthritis. Stiffness and limited motion are typically worse when first getting out of bed in the morning or when one is getting up after sitting for a long period of time. Your joints might make noise of grinding or popping. Walking or stairs may become more difficult as the condition worsens, and you may walk with a limp due to pain, or you may need to reach for that cane if that condition worsens. Let's not let it get to that point if you can address the pain early using physical therapy. Pain and stiffness, loss of motion, walking with a limp, and difficulty climbing stairs are the most common complaints we hear with knee and hip osteoarthritis. So you ask, how can physical therapy help? Therapy can help you stay active by teaching you proper exercises, joint protection strategies, pain management, and safe walking training if a walking device is needed. We can also teach or make recommendations for healthy lifestyle changes to manage your weight. Therapy can help you with symptoms of joint stiffness, help you strengthen and stretch the hip and knee and shoulder. You may also learn to use a cane or other devices to limit the amount of limping or pain that you have with movement until the pain improves. And this is most important to prevent you from getting a worse injury from a fall. With physical therapy, you will also learn how to keep your hips, knees, and shoulders healthy with a home exercise program that your therapist designs for you and reviews during clinical session visits. We also want to make sure you can perform the exercises safely and teach you how to progress safely without compensating or causing yourself more pain. The exercises should be performed at your tolerance and without causing severe delayed onset of pain. Some people call this DOMS, or delayed onset muscle soreness. Mild soreness is expected with a good home program, but should not last any more than 2 to 3 days. If you have shoulder or hip or knee replacement surgeries, therapy can also help you regain strength and movement by helping to manage your swelling and pain, and we will also train you prior to your surgery depending on your insurance and your doctor who makes the referral. What are a few things you should also know? Treating persistent pain is complex. It can be hard to find the right combination of therapies to help you feel your best. You will not always have pain if you address your concerns early. X-rays and MRIs are not always needed if you start addressing the pain early, and this could save you a lot of money. Medicines are common, but pain medications only reduce pain by about 30% on average. Therefore, including multiple treatment approaches, including physical therapy and chiropractic services, into your daily routine can help you find as much relief as possible. Your brain is sensing a threat, which produces pain to tell your body something is wrong and for you to take action. What is pain, you say? Your body has a network of nerves that carry messages to your body and your brain. They monitor and notify you of a threat like an alarm system. It may be slight in the beginning and you ignore the pain, but as the condition worsens, the pain becomes more frequent, more intense, and then it becomes more constant. Pain should not cause you to be afraid. It's a signal for you to make a change. With good self-care and awareness along with therapy, musculoskeletal pain can improve within 4 to 6 weeks. Self-awareness includes those healthy lifestyle changes of being mindful of your health and wellness, staying active, eating healthy, managing other chronic medical conditions like heart problems or diabetes, and as easy as getting those frequent scheduled health screens and wellness visits with your physician. If you do not have a primary physician, then that should be your first step to take towards your lifestyle change. Our therapists are certified in hands-on manual therapy techniques, dry needling, use of modalities like ultrasound, electrical stimulation, and evidence-based therapeutic exercise.
Hey everybody, I'm Dr. Kenneth May, and I'm here with Centera for Northern Virginia. I'm our chiropractor, and I also perform our acupuncture. As you guessed, most of my care is revolved around the spine, so what we're going to be talking about today is mostly about the neck and the back. I've got a little bit of information about how our spine changes as we age. So that's why it's titled, Oh My Aging Back. We'll go over some of the common points, some of the key factors, things to know about, things that you might want to know about before you go doing an internet search to make things a little less scary and a little more understandable. There are 3 main things we see that change in our spines over time. The first of which is our vertebral discs. Earlier in our lives, they hold lots of fluid in their centers, and as we age, they gradually hold less fluid in them. As our discs hold less fluid, our spines technically become a bit shorter, and this can be a part of why we lose some of our height as we age. One bonus to holding less fluid in our discs is that we're much less likely to experience disc injuries like we would earlier in our 30s and 40s. The second most common thing that tends to change with time is how smooth the cartilage in our joints is. When our joint surfaces are less smooth, this is what we more commonly refer to as osteoarthritis. Just as I said earlier, this does not mean that we will have pain as a result. Stiffness is usually present as a result, but as for pain, not so much. The third thing I'd like to discuss is the topic of bone spurs. Bone spurs usually have a very negative connotation, but in reality, it's a very normal thing, and it's a part of how our body adapts to the changing mechanics of a region to make sure that weight or forces are properly distributed among the bones safely. Yes, there are instances where bone spurs can cause pain, but the vast majority of bone spurs are a normal aging process, and again, doesn't mean that they cause pain. As these things happen, we can certainly start to experience more stiffness in our spine. And as we have more stiffness, we might change the way we move, and we might move less. And that's where it's important to make sure that you're stretching, you're staying active, and you're exercising. If you don't, that's when you end up being more prone to pain. Now, if you end up with some sort of injury to the spine, and you have any combination of these 3 things we've discussed, it can complicate or delay the recovery process. But it doesn't mean that it's impossible to get better. There are 3 locations I'd like to point out where back pain is most common. Disc pain, which is more central in the back and very dull in nature. Facet pain, which means joint pain, is just off the center on either the right or the left side, usually with a pinching or a sharp type of pain associated with a specific movement. The third is sacroiliac pain. We usually refer to the sacroiliac joint as our SI joint. This is where your spine meets and connects with your pelvis, and most forces are transferred from your back into your legs or from your legs up into your back. SI joint pain will usually catch you when you're trying to get in or out of a chair, and it has more of a sharp or a pinching pain similar to facet or joint pain. On our fourth slide here, you can see that depending on your age, you are either more likely or less likely to experience pain from one of your discs. Remember, this is because as we age, we hold less fluid in our discs, making them more dense or tough, if you want to think about it that way. I like to look at this as a good thing because disc injuries tend to be more intimidating and complex for us compared to joint pain. So look at getting beyond 50 years of age as a good thing. The good news is that everything we've gone over in this presentation can be addressed by conservative treatment almost 95% of the time. This means that in most cases, no injections or surgery are needed. This is important as surgical procedures are tougher on our bodies as we age, and safety is always the first concern when it comes to any treatment revolving around our health. Chiropractors are well known for adjustments, also known as spinal manipulation. But did you know that chiropractors, as well as physical therapists, are well equipped to treat spine-based conditions with all of these listed therapies as well, many of them being very gentle. Clearly, more conditions can give us pain in our spine. So here is a more comprehensive list of the more common or well-known spinal-based conditions. The good news is while there are plenty of reasons for spine pain, our team is well-trained and ready to assist our local community for just such reasons. One of my favorite things to tell patients is we've got your back. All right, so that pretty much wraps everything up. I'm hoping I was able to answer some questions you might have had or just maybe teach you some simple facts or information about the spine and how things do change as we age. Some things good, some things actually not so bad. If you have more questions about any of these topics or about anything that we discussed today, you can feel free to call Centera Therapy Centers, schedule a consultation appointment with myself or any of our other providers on Spine Care team. That way we can go over it in person. It's much less intimidating than trying to look some of these things up online and figure it out when you're given all these pretty scary suggestions about what might be going on. We're more than happy to answer your questions and help you out, make sure that you or any of your loved ones are getting the care that they need.
Thank you for the opportunity to present on the aging joints. Our practice follows CDC and Centera Healthcare's policy for COVID-19, so you don't have to worry about that. If you have any future questions or are interested in evaluation or consultation, please give us a call at 703-523-1680, or you can have your physician fax an order to 571-589-2009. Thank you.